Hi, my name is Leonard Weiss. I'm a psychiatrist in private practice here in Austin, Texas. I wanted to talk today about the diagnosis of attention deficit disorder or ADD in the adult. Uh, you might have heard of attention deficit hyperactivity disorder or ADHD, which is another form of the disorder. However, that's usually in children, the hyperactivity part. We do occasionally see that in the adult. In any event, how do we make the definitive diagnosis of ADD? The definitive diagnosis of ADD is made purely by psychological testing. That is a trained psychologist, usually a PhD, maybe a PsyD, administering a battery of tests to the individual and finally determining whether or not they have ADD. We also can have a guide as to whether or not a particular patient has ADD simply by looking at the definition of the disorder in what is sometimes kiddingly called the Psychiatrist's Bible or the DSM, Diagnostic and Statistical Manual, and looking at this purely descriptive definition of ADD or ADHD and seeing whether or not that person satisfies enough of the bullet points or behaviors to make the diagnosis. In order to decide whether or not a person is to be sent for costly and time consuming psych testing, which is necessary to make the diagnosis, sometimes the disorder can be successfully screened by various tools. I prefer to use the ASRS or the Adult Symptom Checklist, put out a number of years ago by WHO or the World Health Organization out of the United Nations. This test or this screening test has been successfully administered around the world and is a very simple way of rating degrees of attention or inattention as well as hyperactivity given a very simple scoring system. Once the person has been screened for the possibility of ADD, and again, before they undergo extensive psychological testing, it's often a good idea at that point to send the patient to their primary care physician so that they can get a regular good old history and physical as well as some basic blood tests and urine tests. Why is this important? It's important because if the person happens to have a more organic or medical disorder, like for instance hypothyroidism, which can be detected through the physical and blood tests, we don't want to treat hypothyroidism with ADD drugs. Hypothyroidism is treated with thyroid drugs. Similarly, if you have a person who may be drug seeking and is hooked on street drugs of the stimulant type, that type of person may very well show up in the office seeming to have attention deficit disorder, whereas the main problem, of course, lies with their street drug or stimulant drug use.